Good morning, good afternoon, and good evening, everyone. To the Honorable Dr.dr. Putu Sriwidyani, Sp.PA, as Block Coordinator, Professor Dr.dr. Wayan Putu Sutirtayasa, M.Si, as evaluator, and Dr.dr. Made Sudarmaja, M.Kes, as facilitator. This time, SGD B4 will make a presentation about incompatibility in blood typing examination according to ABO system. Okay, this is our SGD B4 member. Next slide. This is the overview of our presentation.
Okay, good morning, good afternoon, and good evening, Dr. and friends. My name is Yosefina Traslataji with last student ID number 087. I will explain the chapter 1 about the introduction. Okay, first one is background. ABO blood group is a test to determine an individual blood type. That's what that was discovered in 1901 by Carl Landsteiner. It divides blood groups into 4 major types. There are A, B, O, and AB based on the presence of A and B antigens on the surface of red blood cells. Several studies also found that ABO blood group system is associated with some disease. And main methodology for ABO typing usually use manual agglutination testing, but in new methodology have been introduced such as column agglutination and solid phase system. In some cases, accidental intransfusion can cause transfusion reactions. This is caused by ABO incompatibility. ABO incompatibility causes acute hemolytic of fetus and newborn. This is the reason why a bedside compatibility test or PBCT is really needed to be performed just before the blood transfusion.
Good afternoon, doctor. My name is Sanet Malinda and my last number is 092. I will explain about problem formulation, purpose of writing, benefit of writing. Problem formulation, what is ABO blood group system? What is a blood typing examination? What is the mechanism of blood typing examination? What is the purpose of blood typing? What is incompatibility in blood typing examination? Purpose of writing, knowing about ABO blood group system, knowing about the blood typing examination, knowing the mechanism of blood typing examination, knowing the purpose of blood typing, knowing the incompatibility in blood typing examination. Benefit of writing, able to know about ABO blood group system, able to know about blood typing examination, able to know the mechanism of blood typing examination, able to know the purpose of blood typing, able to know the incompatibility in blood typing examination.
Good afternoon, doctor. My name is Anastasia Gunat Roslin with last 3 digits to the number 089. So this is the history of ABO blood type. In 1901, Carl Landsteiner, an Austrian-born American man, discovered the ABO blood groups that we know nowadays. The source is from Lawler and Bergman to 2019. Carl found that antigens and antibodies, which were substances in blood that induce the clumping of red cells when red cells of one type are added to those of a different type. There are 3 groups, A, B, and O, which were grouped based on their reactions to each other, and there is actually the 4th group named AB.
Hello, my name is Juven Lufianto with last student ID number is 091. Okay, introduction to ABO blood system. ABO blood group system indicates the antigen on the surface of the erythrocyte. These antigen are carbohydrate structure, which can evoke and react with the antibody on the erythrocyte surface if the antigen and antibody on the same type. This is why if transfusion of same blood type can cause cell hemolysis. ABO blood group system is based on inherent properties of erythrocyte. So the individual blood types depend on the blood type of the parents. And there is 4 basic ABO blood system. It is A, B, AB, and O. Individual with A blood type mean in their erythrocytes contain A antigen. As well, the B blood type contain B antigen on the erythrocyte surface. Whereas O blood type does not have A and B antigens in their erythrocyte surface. The precursor of ABO blood group antigen is H antigen. All ABO blood group have H antigen on their erythrocyte surface, except for Bombay individual. The H antigen is not present on the surface. This is because a mutation in their gen.
Hello, my name is Theodore Manzinababan. My last 3 digit student number is 093. So, Bombay individuals don't have ABH antigen on its erythrocytes, but contains anti-A, antigen B, and antigen AB in the serum. Para-Bombay individuals have small amounts of H antibody and are less reactive. The FUT1 gene is mutated, which cause H deficiency phenotype.
Okay, I will continue the presentation. My name is Anggiamanda Trena Devi, with last 3 digit of student ID number is 088. I will explain about mechanism of blood typing examination. As we already know, ABO blood group system is a well-known blood group system as each individual has antigens found in the red blood cells and antibodies found in the serum. Carl Lenzener is the first person that discovered ABO group. There are two types of ABO, which is forward and reverse typing. Forward typing is using blood samples that are placed in two test tubes, and then it will be mixed separately with reagents of anti-A antibodies and anti-B antibodies that are already prepared. The purpose is to check antigen A and antigen B in patient red blood cells. The sample that is used in this method are patient's red blood cells. Meanwhile, reverse typing is using samples that are also placed in two test tubes, but it will be mixed with red blood cells reagent, which is A1 and B cells. The purpose of this test is to detect ABO antibodies in patient serum. The sample that is used in this method is blood serum.
Hello, my name is Felix. My last 3 digit number is 099. I will continue the presentation. Other than forward and reverse typing, there are also another approaches of blood grouping, which one of them is slide test, which is using a glass slide. The glass slide will be divided into 3 sections, anti-A, anti-B, and also anti-D. In each section are mixed separately with 1 drop of blood. ABO and rhesus were determined from the agglutination that happened. Thus, the disadvantage from this test is it is the least sensitive method among the blood group examination. There is also microplate technology to determine blood plasma and RBC's antigen. This method is more sensitive and faster. The more moderate approach is the column or gel centrifugation. The blood serum is mixed with reagent from anti-A, anti-B, and also anti-D in columns. The columns are made from the microtubes which contain gel matrix that trap agglutinates. The advantages of this method are less sensitive, easy to operate, and straightforward. The last other approaches is the DNA-based method, which can be used for testing blood antigens. In some clinical cases, DNA-based testing for blood group antigen is a standard choice. Unlike the direct method, the DNA-based testing is an indirect method, which uses genotyping to determine patient blood group phenotype. The advantages of this method are DNA-based testing, able to unravel ABO group disparity, decide patient subgroup status, discover the original blood type of patient who will receive massive blood transfusion or organ transplant by testing a buccal sample.
Okay, I will continue the presentation. My name is Putu Sriwidyani with 3 last digit student ID number is 098. Purpose and importance of blood typing. Blood typing is so much significant that there are at least 5 goals for blood typing or blood grouping. Next slide. The number 1 is get information about your blood type rarity. Blood rarity dependent on the antigen type and rhesus factor on your erythrocyte surface. In Asia, the most people with blood type O positive is 39%, and few people with AB negative blood group is 0.1%. The number 2 is understanding your donor type. In some moment, humanitarian organizations such as Indonesian Red Cross Society may call on their blood donors for specific blood type, mainly if has been a calamity. Number 3, receive compatible blood in an emergency. Theoretically, blood transfusion are carried out with the following condition. The first one is zero blood type or O blood type can be donated to all blood type due to it does not have antigen but can only receive from O blood type itself. In this case, O blood type is usually called a universal donor. The second one, different from O blood type, AB blood type just can receive from all blood type due to it not having antibodies. So AB blood type is usually called a universal recipient. The third one, blood type, A blood type, can donate to A and AB blood type and can receive from A and O blood type. The fourth one, B blood type, can donate to B and AB blood type and can receive from B and O blood type. And the last one, need more attention to the rhesus factor. The rhesus negative can be donated to rhesus positive or negative, but can only receive from itself.
Okay, I will continue the presentation. My name is Azamira Safadila with student ID number 094. The next one is lighten your health condition. According to researchers, there is correlation among non-outlet and unfavorable cardiovascular occasion like acute coronary syndrome, cerebral ischemia, cardiac arrhythmia, and so on. And the last one is have a good plan for healthy pregnancy. A mother-to-be wants to have babies should initially realize her blood group, particularly the rhesus factor. This is so important prevents when the baby is born, it will experience jaundice disease.
Okay, I will continue the presentation. My name is Audrina with last 3-digit student ID number 097. Right now, I will explain about incompatibility in blood typing examination. Next slide. So incompatibility of blood typing can be caused by several things. And in the ABO group system, there are several examples for incompatibility in blood typing examination. There are 3 examples in this slide: ABO incompatible blood transfusion and hemolytic disease of the newborn. Now, I will explain the first point. So, ABO incompatible blood transfusion mistakes is usually caused by human error, especially in health workers in the form of misidentified the patient, sample exchange due to mislabelings, and mistakes when taking blood samples, and also blood type writing errors. And because these errors in transfuse often occur, it is necessary to have a pre-transfusion test, usually to done and see the match of recipient and donor, so we can avoid the occurrence of possibilities such as causing agglutination or hemolysis. And if this condition is not treated immediately, it can also cause like stroke, excessive bleeding, damage to the kidneys, or leading to death.
Okay, my name is Alamanda Chandra with last 3-digit student ID number 086. So other than human errors in incapability of ABO testing, there's also tests
to determine one disease caused by incompatibility in ABO testing, hemolytic disease of the newborn, or in short, HDN. The test is called Coombs test. So the HDN caused by the transplantal transfer of the immunoglobulin G from the mother. For example, a baby who has A or B blood type born from a mother with type O. So with this test, by using direct Coombs test on infants, especially with jaundice, direct Coombs test on infants detecting antibodies using anti-human antibodies, or we called it as Coombs reagent. If the red blood cells agglutinate, the result is a positive direct Coombs test. In conclusion, Coombs test can be used in diagnosing incompatibility ABO blood testing disease, or HDN.
Okay, so I will continue to the chapter 3. My name is Christian with last 3-digit number is 096. The conclusion is ABO group tests performed to determine blood type of a person and were discovered by Karl Landsteiner in 1901. And this ABO blood groups is divided to 4 major groups by indicate the antigens in the surface of red blood cells. There are 2 steps for ABO blood group tests, which is forward typing and the reverse typing, and also called a tube test. And other methods of blood groupings such as slide test, micropipette technology, column gel, centrifugation, and DNA-based method. Blood typing is so much important for blood transfusion and also when determining a person's blood type before doing blood donation. It helps to make sure that people get the compatible blood type. ABO incompatibility primary causes hyperbilirubinemia and hemolytic disease of the newborn, or HDN. A screening test called direct antiglobulin test, DAT, or Coombs test.
Okay, this is the references that we use in the making of this presentation. Next slide. Okay, next slide. Next slide. Okay, this is the end of our presentation. We are sorry if there is any mistake, and we thank you for your attention.